Asia in terms of our support to countries. As you know, UNICEF is a very decentralized organization. We do work closely in collaboration on the ground with each one of the government agencies here that has presented, and will continue to support. But 3 areas of priorities is, the first one is in terms of ensuring that we can move ahead with more inclusive assessment and certification and identification processes. We've been working, as we heard earlier, with Nepal, looking at how we can develop and support development of apps and different channels to reach better and to be able to be more inclusive of people that are further away or rural areas, for instance, to ensure that they can participate within these different programs. We do work also with India, with the UDID, to try to make sure, as we heard from the presentation yesterday, the need to continue to work to be more inclusive and to break some of the barriers of stigma associated with it, to ensure that people with disabilities and children with disabilities can also be included in this. We've also, the second point that I think is important for us to look at and will continue is to see how do we continue to prioritize and establish, where there aren't disability-specific social protection schemes. And this would include looking at supporting, for instance, the government of Bhutan in building on their child disability assessment app that they've presented to us, and looking at how can we ensure that there is a specific scheme for children with disabilities that currently is not available, especially now that they are in the process of building this new social protection framework and policy, and ensuring that from the very start, people with disabilities and children with disabilities are fully included. We also see the importance of working on ensuring that within the social protection systems to not forget those that provide the care and support. Often these are family members, and these have repercussions in terms of the household's ability to move out of poverty and to be able to generate income, but it also has further repercussions often in terms of the division of labor because of trade-offs in terms of who goes out to work and who is there to continue to provide the support necessary for every person within the household to be able to participate fully in society and in work. So the examples that we heard from India, we are looking to see how we can share wider within India to go from the state level to the national level and see how can these be learned and taken on by other states within India and also within the region. We've heard also the example, for example, in the Maldives, where they've also moved towards a care support system. And this is examples that we want to see how can we ensure that these additional costs that often have implications in this household being able to have sufficient income are taken into consideration. And then the final one that is something that we're working on in more broader context is interoperability and coordination. So promoting interlinkages between social protection systems and other services, whether it is specifically for children or specifically for children with disabilities or wider people with disabilities. So how can we promote these linkages? We've heard a lot of interest in seeing how do we build and use digital systems, whether it is for management information systems, interoperable systems, to allow for these linkages. We always take a human also centered approach where we know that it is important to bring frontline workers to be that interface, often to support those interlinkages and coordination between the different services. So working with social service workforce or case management approaches is also something that we support across the countries. And then finally, just to conclude, is that we did hear from several participants, including the Maldives and Sri Lanka yesterday, the importance in learning from each other and learning from best practices. And this is the beginning of our journey, where we would like to bring people together to share on different areas of how can we make our systems, especially our social protection systems, more disability inclusive. So I will stop here, Alex, and over back to you.
Thank you very much, Jessica, for this perspective of UNICEF. And I would like now to invite Stephanie Licho for this perspective from UNESCAP on what we heard and also the type of support that can be provided. Stephanie?
Thank you very much, Alex. So, okay, so basically, I think I'd also like to cover 3 points, but perhaps a little bit shorter than the points that Jessica has given. That ESCAP is really a regional commission, and our mandate as a convening power could be slightly different. So the first thing that I like to point out is that ESCAP actually serves as a secretariat for some of the regional mandates. So as I've mentioned earlier yesterday, the 4 Asia Pacific Disability Decades. So because ESCAP serves as the secretariat for these disability decades, it also means that we support the implementation and the reporting of targets and indicators associated with these decades. So specifically for the Incheon strategy, as we've mentioned, the 10 standalone goals. So that is a very big area of what we do. The next area that ESCAP does would be actually to implement some pilots or to carry out some pilots. And I like to draw the floor's attention to some pilots that were taken up specifically in the area of disability inclusive social protection. So we saw, for example, from 2020 to 2021, that there were some pilots on disability assessment, as well as support services at the district and provincial level in the Philippines, as well as in China, for example. And in our region as well, there have been pilots in India, in Bhutan, in Bangladesh. Perhaps these pilots are not directly related to social protection per se, but there have been such pilots as well in our sub-region with regards to disability inclusion. So basically, in addition to reporting on these mandates, we also have very small targeted pilots that we support. And then finally, I think the crown jewel would really be about bringing countries together in terms of a regional and sub-regional cooperation. So in this aspect on disability inclusion, there have been expert group meetings, there have been joint papers that have been drafted based on thematic areas. So for example, there was a paper on a disability assessment that actually ESCAP did with UNICEF about perhaps 3 years ago. So just to round up, I think for ESCAP, because we are a regional commission with our convening power, really our area of support is really in the implementation and in the reporting of these regional mandates on disabilities, to provide normative guidance. And then the second thing, on a limited scale, and sometimes in collaboration with other UN agencies, CSOs, and of course our member states, to have certain limited pilots on specific themes. And there have been such pilots before on social protection. And finally, once again, the sharing of good practices, be it through papers or be it through expert group meetings. So with that, I hand it over to Alex once again. Thank you.
Thank you very much, Stephanie, for those elements. And I think indeed we have seen across the whole region and broader the impact of the Incheon strategy and the convening of different stakeholders, including OPDs, and government officials in advancing this agenda. Thank you very much, colleagues, for all those remarks. I think it's, again, as I was mentioning, we can see that there is really this strong convergence among development agencies around the issues related to disability inclusion and social protection. We see also the emergence of this approach or these questions around care and support. How do we ensure that we develop programs and services that provide better care and support for persons with disabilities across the life cycle, while redistributing and reducing the pressure on family members, especially women and girls? I think this is something that cut across different sectors. It goes together with aging issues. It goes together with gender equality, with early childhood, economic empowerment, and there are also those connection to make with different stream of work. One thing that we mentioned also, but I think it's important to highlight, is the importance of disability management information system, cash transfer for persons with disabilities, and services in preparation and response to disaster and crisis. I think we saw it very clearly during the COVID-19. We talked a little bit about it yesterday, and this is something that I know is at the heart of many of us in the work that we are doing with both national and subnational government. So with those words, I will close now this session, and I will go back to Moses to take us towards the closing. Moses?
Great. Thank you very much, Alex, for bringing in key discussions and priority areas in partnering with development partners as pathways to develop an inclusive social protection system and support services for persons with disabilities. And thanks to our development partners for your remarks. As we move to the end of the meeting, I would like to invite Mr. Bhavesh Trivedi, the Director, Economic Trade and Finance at SAARC, Secretariat, to deliver his closing remarks. Over to you, Mr. Bhavesh.
Thank you, Moses. Am I audible?
Yes, you are.
Let me begin by thanking UNICEF, ESCAPE, Policy Dialogue, taking forward the agenda of social protection and support services for persons with disabilities in South Asia, and for the invitation extended to the SAARC Secretariat to participate in this important discussion. In 2014, SAARC, in partnership with UNICEF ROSA, convened Enhancing the Financial Sustainability and Effectiveness of Social Protection Systems in South Asia, which resulted in country-specific actions to strengthen the national social protection system, which member states have worked towards. As we conclude our discussions today on enhancing life cycle social protection systems for persons with disabilities and children with disabilities in South Asia, it is important to reflect on both the progress achieved and the barriers that remain. Across the region, countries are making notable strides to promote inclusivity and expand support for PWDs, persons with disabilities. For example, in Bangladesh, notable progress includes the allowance for financially insolvent persons with disabilities, which now supports over 825,000 recipients with monthly transfer of Bangladesh Taka 700. This program is a crucial step in addressing the financial vulnerabilities of PWDs. Furthermore, the government's recognition of disability inclusion in its 5-year and perspective plans underscores a long-term commitment to ensuring PWDs are not left behind. Bhutan has made notable advancements with its Bhutan Child Development Screening Tool, a unique initiative in the region. This tool helps identification of developmental delays and disabilities in children at an early stage, enabling timely intervention and support. India has pioneered caregiver allowances in Kerala and Tamil Nadu, recognizing the invaluable role of caregivers and reducing the financial burden on families. These initiatives can serve as a model for other countries seeking to integrate caregiver into their social protection systems. In the Maldives, efforts to create one of the most inclusive social protection systems in the region are commendable. The country has introduced a caregiver allowance and integrated the Washington Group questions into its national survey, which will enhance data quality and inform evidence-based policymaking. These steps reaffirm the Maldives' leadership in disability inclusive protection system, social protection. In Nepal, the development of a categorical system for disability benefits has simplified access and eligibility, ensuring that support reaches those who need it most. The country's innovative mobile application for outreach to PWDs represents a significant step towards improving accessibility and inclusion through technology. Pakistan has taken a significant step forward with the introduction of the Himmat card. As part of the 23-24 annual development plan, a scheme worth rupees 2.6 billion has been launched to provide financial assistance to 65,000 PWDs across Punjab. This targeted initiative represents a meaningful investment in improving the financial security of PWDs. Sri Lanka has demonstrated resilience during the COVID-19 pandemic by adapting its existing schemes to ensure that PWDs were protected during the crisis. This experience underscores the importance of leveraging established systems for rapid response in times of need. Despite these achievements, challenges persist. And to overcome this, I underscore three key priorities. Number one, improved disability assessments. Accessible and rights-based disability assessment mechanisms are critical to ensuring fair access to social protection. These mechanisms must evaluate support needs and consider social and environmental factors, moving beyond a purely medical model. Number two, strengthened social protection systems. Multi-tiered, disability-inclusive social protection systems are essential. These systems should provide income security and address disability-related costs across the life cycle. Expanding existing schemes and introducing comprehensive disability benefits for children, adults, and caregivers is imperative. And priority number three is stronger interlinkages and access to public services. Social protection must work in tandem with accessible public services such as health, education, and housing. Investments in inclusive education, community-based care, and assistive devices are vital to achieving meaningful participation for PWDs and CWDs in society. We have heard yesterday how member states have identified their unique sets of challenges in addressing the needs of persons with disability. And SAARC, as the regional organization, will extend full support and collaborate with our partners to take forward the agenda of social protection and support services for persons with disabilities with our member states. We are committed to the promotion of the social charter as agreed by our leaders, and let us take inspiration from the successes and address remaining barriers with determination. Together, we can ensure that all persons with disabilities and children with disabilities can lead fulfilling lives with dignity and equality as integral members of our societies. Thank you so much.
Thank you very much, Mr. Bhavesh. Really appreciate you for your closing remarks and the recognition that you have given to the discussions that have taken place and the next steps and providing hope for persons with disabilities. Dear participants, we have had a meaningful and substantive 2 days of discussions on the critical role of social protection in advancing access to support and services for persons with disability. The presentations and panel discussions have highlighted the practices and lessons learned across the region for governments and development partners to strengthen existing policies and programs and areas for further collaboration to advance this agenda. We hope to continue this collaboration and engagement moving forward. As we come to the end of these discussions, I want to thank each and every one of you for joining this meeting. And like everything, there is always an end, and therefore we say goodbye, and we look forward to meeting you again at a different forum. Thank you and have a great evening. Goodbye.